Well, look, I think everybody wants to get to that point where we can get life back to normal. But the way we're going to know it's back to normal is we have enough data to know that we've started to go back down and bend that curve down. We can't do that without getting enough testing and to see those numbers going downward, see the ventilators going down, the ICU beds going down, hospitalizations, and see the infection rate going down. So testing is still a big need that we have to ramp up.
What is the biggest problem with testing? Is it the kits? Is it the personnel to do it? What is the bigger holdup right now? It seems as if you open up a testing site and they run out of tests before they run out of people.
Yeah. So we've got testing sites open all across the state and not enough kits, and it's really that's the issue across America. Okay. I know that the federal administration is taking steps and making progress, and so are all the states, but that's where we're way behind. It's on the actual materials, the tests themselves. That's what I thought. The other side of the equation, it's ventilators and personnel in the hospitals. That's the big issue.
We've said from the beginning, the more we test, the more positive we're going to get. That's true in Mississippi. That's true across the country. And that's also the reason why I think if you, at this point in the cycle, look at states' number of cases and only look at that data, it doesn't give you a full picture. It's number of cases compared to how many tests you've actually done in comparison to how many people you actually have.
I don't care which link breaks in the chain. The chain is still broken. It doesn't matter which hospital, which link. Any link breaks, the chain breaks. The healthcare system is a chain. It breaks anywhere, it breaks everywhere. That has to be our mentality.
We have National Guard members in our Emergency Operations Center. Their planners have arrived and are helping us anticipate and build out our hospital surge capacity. They've been absolutely fantastic. But since January, the National Guard has been a part of the plans for how we're going to deal with this virus in South Dakota. Now, there's a certain threshold that you have to meet in order to utilize the National Guard at the federal level for that recognition to happen, but people in South Dakota should be well aware that our National Guard have been serving us through this situation for weeks and months already. And we're incredibly grateful for their leadership. They come in at times of crisis and need, but also their logistical information and ability to plan and work out systems and get resources where they need to be has just been amazing. So they are very helpful, and I know the Secretary of Health has been utilizing them this week and doing a lot of the modeling and the needs that we'll have to have in place in order to deliver health care in so many of our communities in the coming weeks.
South Carolina is thriving. Now this is going to be a suspension of that thriving, but we're going to get through it, and the way we'll do it is by following the rules, having common sense, being a good neighbor, and doing everything you can to try to find the bright side. We all gonna come out of it.
It's right that we are working hard on the medical challenges this virus presents, but we also must work on the economic fallout created by this disease. I don't need to tell you what you already know. We have seen a significant increase in unemployment claims over the last 2 weeks as a direct result of the economic slowdown. Virtually overnight, the labor customer service representatives went from an historically low unemployment period, which had lasted for well over a year, to the highest call volumes we have ever seen, higher than even during the height of the Great Recession. So now more than ever, we must be kind, we must support one another, and as I've said before, and I'll say it again, together we'll get through this.